This procedure video will take you through the techniques of eFAST. The ability to perform a fast scan is now a core competency and as such could well appear in the MChem OSCE examination. Again, this could appear as performing the procedure itself or explaining the procedure to a medical student. This video will give you an overview of the basic layout of an ultrasound machine and the key areas to examine during an eFAST scan. The video will also show you real-time images of the examination zones as well as some still frames demonstrating some abnormalities in each of these areas. We hope this video will provide a brief overview to eFAST, but can by no means replace a formal ultrasound course or even better hands-on ultrasound experience in the emergency department.
Welcome to eFAST. The most important thing that you need to start with is get your ultrasound machine and actually learn to find out where the power button is. In this machine it's there. So plug the computer in, switch it on. Then what you need to do is make sure you've got the right setting on your computer screen. So for eFAST you need to start with a low frequency curved probe that you need to make sure is inserted correctly. Then you need to make sure you know where your depth buttons are so you can adjust the depth for your patient. Also, depending on the area you're looking at, you'll need to be focusing and changing your gain buttons, which are here. So you can either change your near gain or at the other extreme your far gain. You can use auto gain, which you can just hit, or you can use the general gain button, which will turn the picture generally up or down. What you'll then need to learn to do for the sake of trauma patients or patients with abdominal pain is to know how to freeze your images and save them so that they can be looked at again or shown to other members of the team. Every patient that you examine, details should be entered on the system, and so it's also very important to know where your new patient details are that you can press so you can enter the details of the patient. The two probes we use in eFAST is the curved lower frequency probe or the linear array high frequency probe. So introduce yourself to the patient, explain what you're going to do, position your patient appropriately. Often in the trauma setting you can't get an optimal position, but you just need to make do with how the patient is and how their pain is. So you start by scanning in 4 areas: Morrison's pouch, linear renal, pelvic and pericardial. So you put the probe at the level of the costal margin in the mid-axillary line, always making sure that the probe is facing towards the patient. There's always a little marker on the side. Steady your hand if you can against the bed, and then in your view you should be able to see the kidney, the liver and the costophrenic angle. Move over to the linear renal angle, where this time you're in the 9th to the 11th rib, posterior axillary line, and this time again looking at the left kidney, the spleen and the left costophrenic angle. After this you move down to the pelvic region and you look at the bladder, initially in the transverse plane. And then in the sagittal plane. After that you move up to look at the pericardium. Do warn the patient, you do need to put quite a lot of firm pressure on this. You're using the liver as an acoustic window. Always check by looking at the patient's face. And look for any free fluid around the pericardium. If you have problems in that view, you can move to the left parasternal view, and you can also gain your images there. If you're going to do an extended fast looking at the pleural cavity as well, you need to change your probe. You need to look in both lung fields completely, right from the apexes of the lung all the way around to the lateral aspect. So initially, starting up at the very top, you're looking at your screen for sliding of the pleural surfaces. And you can also use M mode to confirm there's no pneumothorax. Then move the probe down a rib space at a time, checking for sliding and using the M mode all the way around. Repeating it on the left side of the lung again, starting right at the top of the lung fields and moving all the way down. So you're checking all the way around for any pneumothorax, using the M mode as confirmation.